Hello. Your pelvic floor is a group of muscles within your pelvis starting from your pubic bone at the front to your tailbone at the back. The pelvic floor muscles act as a hammock or sling to provide support to the bladder and back passage, as well as to the womb in women. The muscles allow you to hold on and only go to the toilet when appropriate, and prevent any leakage of urine or faeces. This video will show you some exercises to help strengthen your pelvic floor. These are particularly important if you're experiencing any changes in bladder or bowel control, are pregnant, or have recently had a baby. Before you begin, you need to get a sense of where your pelvic floor is and what it feels like. Imagine trying to stop yourself from passing wind and passing urine at the same time. Trying to do this involves tightening and lifting the muscles around your back passage and front passage. This is your pelvic floor. When you're tightening the pelvic floor muscles, you should try and avoid holding your breath, pulling your tummy in tightly, squeezing your legs together, or tightening your buttocks, as this uses different muscles. Pelvic floor exercises are often referred to as a secret exercise, as no one can see that you're doing them. You can do them anywhere and at any time, although it is important not to do them when you're passing urine, as this will stop the flow. Once you become familiar with the feel and position of your pelvic floor muscles, you'll be able to start the exercises. You can perform pelvic floor exercises in any relaxed position, but to start with, you may find it easier to do the exercises while sitting or lying down. Exercise 1. Slowly tighten and lift your pelvic floor. Hold this for up to 10 seconds. Relax for a few seconds before repeating the exercise up to 10 times. Exercise 2. Tighten and relax your pelvic floor muscles as quickly as you can up to 10 times. Hold each contraction for approximately 1 second. Make sure that you completely relax your pelvic floor muscles in between each exercise. Ideally, you should perform the slow exercises first, followed immediately by the quick exercises, repeating them 4 to 5 times a day. It's useful to give yourself reminders or cues to perform the exercises throughout the day, for example, before you go to bed or after passing urine. Other things that might help to strengthen your pelvic floor include trying to maintain an optimum body weight whilst avoiding constipation, heavy lifting and any high-impact activities. This means anything that involves both feet being off the ground at the same time. The knack technique can be used to try and reduce straining of the pelvic floor and prevent leakage of urine. When you cough, sneeze, laugh or pick something up, you should try and tighten your pelvic floor muscles before and during these activities. If you perform these exercises regularly, you should see some improvement in 3 to 6 months. Some people may notice an improvement in 6 weeks. It's important to remember that pelvic floor exercises are for life, and you should try to make them a part of your daily routine. If you stop doing the exercises, your symptoms may return. If you have any questions, please contact the physiotherapy department for advice.